Hi, I'm Dr. Alvarez with Endobariatric.com, and welcome to another of our episodes. And today I have a special guest, and it's going to be like having a small interview here, like sipping on some coffee. And Peggy is a former patient of mine, and a few years back, I used to have hair, Peggy.
Yes, he did.
And Peggy came back to visit me, which is a great honor. And Peggy, you want to introduce yourself and where you're from?
I'm Peggy Scoville. I'm now from Southwest Missouri. When I had the surgery done, I was in Northeast Arkansas, so in Paragould.
Part of my NEA.
Exactly.
Gang from Northeast Arkansas. Curious enough, we've done so many patients from that area. And in that neck of the woods, it's just Arkansas. It's just good old word of mouth.
Exactly. I knew dozens of people personally that had been here to see you and had the surgery, and I didn't even do any research. They all talked me into it.
Alone, I know we've done at least about 3,000 patients from that area, which is a lot. Yes, yes. And you're one of them.
Yes.
So tell us why you are back.
I came with a friend who she saw my success with the surgery and she's been trying to make it happen for about a year and a half, and finally decided to pull the trigger and come down and have her surgery done too. She's had some health issues and wants to lose the weight. She did the same thing as I did, went through Weight Watchers and several different diets and gained 50 pounds and lost 50 pounds and then gained 70 and just up and down. And she said she's really good at losing weight, she just wanted to be able to keep it off. And that was my problem too. I could lose the weight, just couldn't keep it off. And I've lost 159 pounds is what I lost at my lowest weight. And I have regained about 10 to 15, but I'm stable where I'm at, and I think I was too low.
Which is the average, you know, patients, I tell patients, they start losing weight, they start losing weight, they hit rock bottom, and then there's a fat redistribution phase where you're right on the numbers, which is about 10, 15 plus pounds, pretty much right there. Because patients on the fat depletion, they hit rock bottom and then you regain, which is expected, you know. Right. But 159 pounds.
Yes.
Oh my goodness! It's
I know.
Just like a complete person.
Right. It is. It's more than half of my weight at the time when I came for the surgery.
Yeah.
So.
I noticed your shirt.
Yes.
The Century Club, over 100 pounds lost.
I reached that at right about 11 months out.
Yeah.
I had 108 pounds lost at one of your reunions. I have a picture with you with my 108 balloon, having lost that weight.
Was that a reunion in Memphis, maybe?
Yes, it was.
Yeah.
Yes, it was.
Yeah. At what's the Elvis Presley resort?
Right, Graceland.
Graceland Resort. Yeah,
yes.
People there treat us fantastic. So, you look fantastic. So, tell us a little bit about your experience, which is important for our viewers to understand that the sleeve is of great help, but it's not magic.
That's right. It's not. I still have to watch my portion size, and if I take one bite too many, I know my nose starts to run. And if I don't stop when the nose runs, then I get hiccups. So that was always my problem, was portion control before the surgery. And now I kind of have enforced portion control because I have an absolute amount that I can and cannot eat. At first I would measure, and now I can just pretty much eyeball or know how much I can eat and how much I can't and when I need to stop. So I'm a cheap date. I can have 3 meals off of a normal restaurant portion.
Take home bags. Take home
exactly.
bags. Yes. So you're one of the lucky ones, Peggy, that get those signs, and I've talked about that on videos, on former videos, on getting the runny nose or getting a cough or getting a little hiccup, or and which is, not everybody gets those signs, but you're one of those lucky ones. But anyway, talking about the sleeve always works, as you were mentioning, as an emergency brake, always on the patient. So yes, you're good at losing weight, but if it's your case that the weight's coming back on and you're yo-yoing, and now you're doing this, now you're doing keto, now you're doing Weight Watchers, now you're doing a personal trainer, now you're doing, and you're back and forth, With the sleeve, it acts as an emergency brake always on, just to help you maintain that weight loss.
Right. And I took your advice. I focus on protein and produce.
Correct.
And so that's my main, a lot of my snacks when I do snack are jerky, things like that. Jerky, carrots, hummus, that type of snack.
And I talk about that, protein and produce, way back when I wrote my first book about 2010, and it's there. And it's in there, and talking about protein and produce, if you focus on that, it will help you tremendously down the road. So it's actually called Successful Weight Loss with a Gastric Sleeve, because that's what we want. I mean, we want something that's sustainable down the road. And you look fantastic. So what have you acquired with 159 pounds less?
Well, one thing, I have a granddaughter who, she was kind of my motivation to come for the surgery, because when she was about 7, she asked me to get on the floor and play with her, and she said, and I had complained before that I couldn't get up if I got on the floor, and she said, "I'll help you get up, Grandma."
Oh.
So that was my defining moment when I decided I was going to have the surgery so that I could get myself up and down off the floor to play with my grandkids. And she's 12 now, and she doesn't have to help me up off the floor. I can get myself up off the floor now. I had back issues. My back hurt all the time. I couldn't walk across a parking lot without being out of breath. And now, shortly after about a year after I had the surgery, I moved up to a 3rd floor apartment in an apartment building with no elevator. So I was climbing the stairs. I never would have considered doing that before the surgery. I spent a week in Tennessee working a part-time job this summer at Bonnaroo with a security company. Again, that's not anything I would have considered 5 years ago. But I'm enjoying life a whole lot more. I get out and do things. I wear my sisters out at holidays because I can't sit down. I get up and down to clean up after the meals. And
so much energy.
Yeah, I do. And they're like, "Sit down, you're making me tired." So.
And what got you going in the first place, Peggy, on the Mexico thing?
I worked with a lady that had been down here 5 years prior to me starting to work with her, and had sleeve surgery. Yes, it is. Yeah, so she was there, and then I started looking around, and there was a lot of people in Paragould that had been down to see you and had surgery, and it was firsthand knowledge. It wasn't something in a book or on a website where it could be, you know, someplace. Doesn't necessarily always true on the Facebook pages or whatever. And these were people that I could stand in front of and see their success and talk to them and know exactly what had happened and how it went. So like I say, I didn't do any research. Once I decided to do it, it was Dr. Alvarez all the way.
I appreciate the trust. Well, look at you now.
Yeah, and I brought somebody back for you too.
And what did she say? Also the same situation? Are we going to Mexico, or she didn't think twice?
No, she didn't think twice because she had seen me, and I had already
experienced.
Right, I had already talked her up about it, and she had seen what I'd done and how the success I was having and how well it was working, and she had seen the change in my overall attitude. I guess I was a happier person and more active and more energetic. So
fantastic.
It's great.
You look fantastic. You transmit that energy, Peggy.
Thank you.
Since the get-go, since I saw you yesterday walk in, it's just amazing. Yes. And what would you say to maybe patients looking into this? You know, maybe they think they're too young. You know, maybe they think they're out of the range of weight loss surgery. Maybe this isn't for me.
I wish I'd done it probably 20 years ago. I'd have had a much more active life much sooner. And you're not too old. I was 61 when I had the surgery. So I'm on Facebook on a couple of different gastric surgery groups, and when people ask about, oh, am I too old or whatever, I always speak up and say, no, you're not. You know?
Yeah. And just to throw it out there, by guidelines, it's usually between 16 and the age of 65, which would make you eligible for weight loss surgery. And out of that range, we handpick patients. I mean, it doesn't mean we can't go out of that range. You can. You just got to be very careful and select those patients carefully We've done sleeves as old at the time of surgery as 78 at the time of surgery.
Wow.
And this 78-year-old lady, her complaint was she couldn't reach enough tennis balls while playing tennis. So everybody has a goal, you know.
Yeah.
Yours was your grandchild, and she had really good overall health, and it was just pretty much her knees that were just killing her. And we crafted her sleeve, and she's very happy reaching more tennis balls now. But yes, it's not that you're too old. It's just every case is different. We evaluate carefully who is eligible, who isn't. Now, don't get me wrong. You could be 55 and not be eligible because of medical conditions. We have to have a perfectly safe surgery. So, but yes, I crafted my mom's sleeve as well at around 62. And my mom just turned 68. So,
Okay.
I mean, my mom was struggling with high blood pressure and was pre-diabetic, and diabetes runs in my family. And I crafted her sleeve. Doesn't take any more pills, no more pre-diabetes stage, and she's like you, just having what we call quality of life.
Yes. I had high blood pressure before the surgery too, and within a few weeks, probably 20 to 25 pounds weight loss, I was able to come off the blood pressure medicine.
There you go.
And then I'm taking a daily vitamin A supplement because my vitamin A was low at my last checkup, but I take multivitamin and some supplements, but it's not anything unusual because at my age I need to take calcium and things like that anyway. So, but I've not had any issues. I can't remember a single issue I've had. I'm also less sick in the wintertime.
Yes.
So
because your
I'm just
immune
more
system
healthy.
is better.
Yeah.
As you lose weight, your body inflammation, all throughout your body, your inflammation lowers greatly. So your immune system is better. Your aches and pains are better, as you were mentioning. I mean, it's just a win-win-win-win-win-win, and it goes on and on. So, well, congratulations, Peggy.
Thank you.
I mean, I appreciate you taking the time to do this, and most important thing, the support giving out to the weight loss community, patients that are out there just, you know, searching or they're on the fence, you know, shouldn't I, will this be for me? And you are living proof.
Yes.
Living proof of 159 pounds.
Yes.
Down, maintained over 5 years.
Right.
Yes.
I still see people that ask me or say comments like, if you don't quit losing weight, you're going to blow away. And I'm not losing more weight, but it's just redistributing or something. But even with having gained an extra few pounds, people still see me thinner and think I'm still losing. So.
No, you look fantastic, very healthy, very active.
Yeah.
Yes.
And I feel great. I was amazed at how much better I felt.
Yes.
I knew I would, but it still hit me that it was amazing.
Yeah.
And you got it started.
I appreciate it. I appreciate the trust, the initial trust. Now I appreciate the support, Peggy.
You're welcome.
Well, thank you very much. Well, again, thank you very much, Peggy, for bringing all this into the weight loss community. And if you guys want to hang out some more, be sure to subscribe to our channel. That way you don't miss any future videos. Thank you very much.